Show. I'm Dr. Kareem, and today we're going to be diving into a condition that affects millions of people, and that's neuropathy. We already talked about neuropathy before, but today I'm really excited to be joined by Dr. Keith Volstad. He's from Volstad Integrated Wellness, and he has extensive experience in treating neuropathy patients from a different perspective. We're going to explore different approaches to care, what outcomes we're seeing, and how we can better serve our patients through collaboration and integration. So, Dr. Keith, I'd like to welcome you. Why don't you share a little bit with our listeners about yourself?
Sure. I've been a chiropractor for 43 years, graduated in 1982 from what was known then as National College of Chiropractic. I think today it's known as the University of Health Sciences in Lombard, Illinois. Practiced in Indiana for a number of years and then migrated to sunny South Florida about 20 years ago and have been in practice down here since then. I have a diplomate in a chiropractic intern of the National American Board of Chiropractic Internists. I passed the boards for the diplomate of the American Clinical Board of Nutrition. I've also done the certification of neuropathy, the Board of Certification of Neuropathy through the American College of Physical Medicine, in addition to certified sports physician, certified spinal disability evaluator. I've done a few things in my life, postgraduate, to have quite a few letters after my name.
That sounds like a lot of education there.
Yeah, it was fun. I enjoyed it. So I'm pretty proud of what I've done in that regard.
That's awesome. That's awesome to have people just like you that are into neuropathy and want to help, our patients who are suffering from this condition. But why don't you tell me why did you pick neuropathy? What brought you into that field of care?
It's there's certainly a business aspect to that, but also I guess it's been 10, 11 years ago, I was introduced to a device called the Magnosphere, which is the only FDA-cleared magnetic device that is balanced with the human body. And through that device and learning how to use it and the people that were involved in using it, I met a gentleman that was treating neuropathy in his office, utilizing magnetic therapy, etc. So, in inquiring through him, I learned about treating a neuropathy and tried it in my office, and it seemed to be successful. And over the years, then I've added and subtracted a few modalities to kind of come up with a protocol that we use today. And we have about a 90 to 95% success rate in helping patients regain quality of life, which is what our goal has been. Neuropathy, from my perspective, isn't really curable, legally speaking anyway. So what we aim to do is take patients who can't sleep, can't walk, can't enjoy their life, and try and reduce their condition to the point where they now can, in fact, enjoy the things that they like to do in their life, thus returning them a quality of life.
That's awesome. That's awesome to hear. All right. So from your perspective, how would you define neuropathy and what are some of the most common causes you encounter?
Neuropathy is basically what the name says. It's a dysfunction of nerve function. So the nerves are not providing input like they're supposed to because they've been damaged. The common causes are things like diabetes, chemotherapy, toxic drugs, things along that line. But I believe all of those causes lead to what I consider to be the main cause of neuropathy, and that's inflammation. Inflammation of the endothelial lining of the capillaries that provide blood supply to the nerves, thus reducing perfusion and starving the nerves of oxygen, which then causes them to become damaged, resulting in dysfunction, leading to the symptoms that they can experience: pain, numbness, tingling, paresthesias, muscular weakness, things along that line. So that's how I address it with my patients, and our protocol is geared towards trying to deal with that.
And how does that impact your patients' day-to-day quality of life?
Well, I can give you an example. We've had patients that couldn't play tennis or golf because of their neuropathy. And after going through the protocol, they're back playing golf and playing tennis. But I think the most interesting story is a gentleman that we had who was 87 years old when he first came in. And the reason he came in was because of numbness and pain, which precluded him from driving his sports car, which was a G40, which is a very expensive sports car, because he couldn't depress the clutch. And 6 weeks into the protocol, he drives in his GT40, ecstatic that he was now able to get out and drive his car again. So I think that's one of the more dramatic stories that lends credence to the success that we've had with how we treat neuropathy.
That's awesome. That's really awesome. So let's dig into what kind of treatments would you start with a neuropathy patient? Or let's even go before that. What do you do initially, exam-wise or anything like that, to determine, yes, this is going to be a good fit for our clinic or not?
Most of the patients that we see in our office have been through the medical gamut of treating their neuropathy. Medications, physical therapy, laser therapy on its own, and have been basically told, I'm sorry, there's really not much more we can do. Gabapentin being the most common medication that they're on. We can increase your dosage of medication to try and mask the symptoms diminish your symptoms. But really, there's not a whole lot that can be done for you. And I hear that story in some form or fashion quite frequently. So our first order of business is to go through what I've kind of just described to you about what their neuropathy is and why they have it, and subsequently then leading into an exam that we do, which is based on the Toronto Assessment for Diabetic Neuropathy, which is a 7 or 8 step examination where we test heat, cold, vibration, fine touch, etc., to grade them, to give them a baseline as to this is where you are. And subsequently then when we've gone through the protocol, we repeat the same examination and demonstrate from a clinical perspective anyway, the improvement that they've incurred, not only subjectively as they tell me, but also a little more objectively with this assessment tool. So we use that. I don't know that I've had, but I can count on my hand the number of patients that we tell them, look, I'm sorry, this is really not a fit for you, or their neuropathy was caused by something that I didn't think we could help them with. But by and large, the largest portion of patients that come in, we've been able to deal with and help. So that's our initial first visit protocol for the patient. And then once they agree to go through treatment, then we establish the protocol and the things that they need to do to help themselves, as well as what we need to do or I need to do in the office.
So what does your treatment protocol look like?
We have about 6 or 7 parts to the protocol. We use and especially, the electrical device, the Rebuilder, which I'm sure you've heard of. We do use laser therapy. We use a specific company that we like. We've tried several different laser devices and have found that some of them don't work quite as well as others. So we've stuck with this specific company that we've been very pleased with and has done a lot in their research in treating neuropathy and have come out with what I consider to be a very quality product. We also use the magnetic therapy that I mentioned to you before. We utilize supplementation, arginine, for example, alpha-lipoic. I put everybody on a probiotic, not because it necessarily directly relates to the neuropathy, but it does address the gut issue in a preliminary or cursory manner to try and enhance the body's immune system. We also provide every patient that comes into our office chiropractic care. So all of those things together that kind of make up our protocol. We have a specific electrical device in our office that's not the Rebuilder. It's H-Wave, if you've ever heard of H-Wave, and we utilize that for them in our in-office care. The protocol itself is 90 days to begin with. It's divided into 2 portions because my experience and what I've learned is that neuropathy needs to be treated every day. It's just not convenient or realistic for the patient to come to my office every day. And like I tell them, I don't normally work on Thursdays. That's my day to play golf. So they need to, have devices at home. So they purchase a couple of devices that they use at home twice a day, every day for that 90 days. And I normally see patients on average once a week for the 90 days. If their condition is really, really bad, then we might see them twice a week for the first few weeks and then cut them back to once a week. And if their condition isn't really all that bad, we might see them just 8 times during that 90-day period, monitoring their progress when they make their office visits. And then, like I mentioned earlier, once they're through the 90 days, we repeat the examination that we did that first visit to demonstrate their change or their clinical improvement. And then I make suggestions to them, give them advice about how to continue normally with their home protocol for a while, but reducing the frequency of their visits to my office because they just don't need to see me so much anymore. When I talk to the patient during the course of care, I tell them that this 90 days, think of it like getting shot out of a cannon. I don't expect complete resolution within 90 days, but we should see a significant improvement. And so the patients are encouraged to continue their therapy at home per my advice based on the exam that I performed after the 90 days. And then like I said, we follow up, let's say monthly or bi-monthly, which time we'll reevaluate and instruct the patient about what they should or don't need to do anymore at home. Question I get very commonly is, Doc, do I have to continue to use these machines at home for the rest of my life? And my answer is that's hopefully not going to be the case. But it is important, in my opinion, that you have these devices because, as I've seen in my 10 or 12 years of treating neuropathy, the condition can reoccur or at least kind of come back a bit. And now, as I have trained the patient what to do about it, they can begin taking care of themselves at home and then alert me, that when necessary, that, hey, the conditions come back, I need a little bit more help. We've only had that happen a few times, but, it is an important aspect of the care that I believe the patient needs to know that they can certainly come back to me and don't be worried if it happens to flare up a bit sometime down the road. So in a nutshell, that's our protocol, and we explain that to the patient, and they do very well with following through.
And I don't know if I missed it here, but do you also put them on a nutritional program or anything like that?
We do have some supplements that we use. One of from a clinical perspective or a science perspective, the inflammation I talked about before is normally in the endothelial lining of the capillary, and the molecule nitric oxide is very important for the body to repair that endothelial lining. So we put them on an arginine citrulline powder that I encourage them to stay on permanently. But that's a once a day. We also put them on alpha lipoic acid, and given their body size determines the dosage size. We also put them on a probiotic because we want to, as cursorily as we can, address their bowel function or their their digestive issues if they have any, because as you know, the immune system is primarily found in the gut. So we want to enhance the immune function, and we try and accomplish that by using a probiotic. We also have and I didn't mention this earlier, but we also have a arginine cream that we ask them to apply at night. They take the powder in the morning, which kind of gives them a big boost of nitric oxide during the day. And they apply this arginine cream in the evening to kind of at nighttime before they go to bed to increase their nitric oxide during the night. Nitric oxide, from my experience, is a key component to helping patients recover from neuropathy.
That's awesome. So what are your thoughts on regenerative medicine options for neuropathy like PRP or stem cells or peptides? Or
I have had patients ask me about that. And in the experience that I've had in the years of treating this, I have seen a few patients that have tried things like what you mentioned, stem cells, PRP, peptides, acupuncture, for example, is another one. And they just haven't really gotten the success that they needed. So it's my experience that those things, at least right now, haven't evolved to the point where they are really beneficial, for the patient.
have you heard of people doing both of what you're doing and putting on top PRP, stem cells, or peptides?
I
So
have
using
not
both.
experienced that. Most patients, when they come to me, um, do not do those things. I mean, if they wanted to try it, I certainly wouldn't stop them. But like I mentioned to you before, I've not seen the success in those things. Doesn't mean that it doesn't happen. It's just I haven't seen it in my practice. One last thing that we do discuss with the patient is dietary management. We do talk about making sure that they're eating healthily, plant-based diet, reducing processed foods and processed sugars. That sometimes can be a real bugaboo for the patient. I actually had a patient not go through the protocol because I encouraged them to monitor their candy and cakes and cookies and things along that line. And they flat out said, "Doc, I can't do that. I'm sorry." And they didn't go through the protocol. I was rather amused by that.
Yeah, I mean, it really comes down to the patient. And that's something that I tell them is, hey, you've been doing it for how long? You need to, we got to do something different, right? In order
Right,
to
exactly.
get
And you've got
different
to be,
results. It's
yeah, and
the
you have to be
insanity,
drastic in
right?
what you do. In what you do.
Yeah.
What's that?
Yeah.
What's the
So it's
definition of
really,
insanity? Doing the same thing, expecting a different result.
yeah.
It
Yeah.
doesn't work
Yeah.
quite
And
that
that's
way.
what I tell the patient too. I was like, well, you want something different. We got to do something different,
That's
something
right.
you're
You're
not used
exactly
to.
correct.
Yeah. Yeah. So what role does patient education play in managing expectation and compliance? Kind of like what you're talking about. How do you do that?
The educational aspect of what I do primarily occurs the first visit, where I try to explain what neuropathy is, why they're experiencing it based on their specific history, how that relates to what I believe being the primary or cause of neuropathy, which is inflammation. And then subsequently each visit, we kind of repeat some of that for them to try and ingrain in their minds the import of what we're doing and what they're doing and why it's working and what they should do going forward to help reduce the risk of a reoccurring somewhere down the road, because it doesn't do any good to go back to a lifestyle that prompted the neuropathy if possible, but to alter your lifestyle so that you can reduce the risk of that neuropathy coming back.
So in your experience, what would you say the biggest obstacles that slow or prevent healing in your experience? And that, yes, you talked about, nutrition wise, if they're not following that, like eating the sugar, or say they're not following the protocols, like doing their treatments at home, you said twice a day. So other than those two, any other big obstacles that you see?
In my experience, Dr. Mahmoud, the number one reason patients don't get as good as maybe they could are the things that you just mentioned, and that's patient compliance. They have got to follow through with what I ask them to do. And if they don't, then don't be disappointed if you don't get the result that you expect. What I tell the patient is, listen, when you come to my office for the visit, I control what you do and you're going to get what you need, but I cannot do that for you at home. So if you blow off doing the protocol at home as I've instructed you and don't take the supplements as I've instructed you and think that you can drink what you want to drink and eat what you want to eat and expect it to get better, then that's not going to happen, and you're not going to get the result that you've expected. And I also give them my past experience with the myriad of patients that we've treated. The 5 to 10% of the patients that don't get as what good a result as we had hoped, even though they did get some result, it's not as good as we had hoped. The number one reason is they didn't do at home what I asked them to do. They were not compliant with the protocol as instructed.
That's kind of what we see in our clinics too. um, is the stuff that they're supposed to be doing at home where you can't monitor. And
Right.
exactly. So where do you see the future of neuropathy? Where do you see the treatment heading in the next, say, 5 to 10 years?
I don't know that there's anything on the horizon that I would point to that I'm aware of anyway, that I would say, oh, I think that's going to be the next best thing. There's one last thing, and I'm digressing a little bit here, and I kind of spaced it in our protocol. We also do whole body vibration. I don't know if you've been to conferences, for example, and have seen these platforms that patients stand on and it basically vibrates their body. I always thought that was kind of a joke. But then in researching neuropathy and treatments that are out there, I came across a plethora of research indicating the efficacy of helping patients with neuropathy by doing whole body vibration. So we added that protocol that they get when they come into our office. And I've encouraged patients to maybe get some kind of a vibrational plate at home. And a few of them have, but that's kind of the newest protocol, piece of the protocol that I've added. That was several years ago. But what's on the horizon, I'm not aware of anything that I would point to that would say, oh, yeah, that's going to be a game changer right there. I will say the one thing that is a bit surprising to me is the lack of interest in this by the medical community. I've done several webinar conferences, I should say, or lectures where medical doctors were in attendance, and I always get pushback, always get pushback. And I'm just amazed at that, at the lack of willingness to accept something that maybe isn't in their wheelhouse per se, but that would really be of great benefit for their patients.
So what's one message you'd like to share with someone currently struggling with neuropathy and feeling hopeless?
The unfortunate thing is that the neuropathy protocol, and I'm sure you probably have experienced this in your office, it takes time and it takes a financial investment. And the number one reason patients don't jump on the protocol is financial. We try to help them get financing and that sort of thing. But what I would tell patients is you got to decide what it's worth to you. Is it worth the investment of your time and your commitment and the discipline as well as the financial commitment to regain your life? And I tell patients this every time. This is a decision that you're going to have to make. And you're going to have to decide, is it worth it to you? And the example I use for them is a pet. How many people will go out and spend $2,000 to $3,000 on their pet, but won't spend a sum of money on their own health? And that kind of opens their eyes a little bit. It is interesting to me that people won't invest not only financial resources, but their time and their commitment to help themselves regain a quality of life and their health. Patients also want to know, Doc, will my nerves heal? Well, can nerves heal? The answer is yes, they can. They may never get rid of the numbness I found to be the hardest thing to get rid of, but the nerves can heal. And that's why, you've experienced a recovery to some extent of your neuropathy. So again, you asked, the biggest roadblock I think is the commitment of the patient in all the areas that I've mentioned.
Yeah, I mean, that's the same thing. I always say, what's wealth without health? I mean, if you don't have your health,
Well,
all the wealth
absolutely.
you have is going to mean nothing, right? Also, your analogy of using a pet, actually, I like that, but I also use the car analogy. I go, if your car breaks down right now and,
Right.
you need to replace it, aren't you going to go and replace that? How much are cars
Yes, that's
nowadays? I mean,
exactly
they're
right.
averaging about 30, 40K at least, if not more. So why would you
Right.
go buy a brand new car object and not do anything about your health?
You're absolutely right. I don't know. Patients just seem to want that pop a pill and I'm going to do better mentality. Where I'm located here in Palm Beach County, the medical community has a real grip on healthcare here, and we're fighting that as well. Palm Beach County is just inundated with the medical community, and I understand why. That's why I moved here. But again, the patients want that immediate result, and they have a hard time understanding that that's just not reality, especially with neuropathy, because what the medical community does for neuropathy, A, only masks the symptoms, and B, and more importantly, doesn't work. But patients don't want to listen sometimes. Very frustrating.
Yeah. Well, appreciate you, Dr. Keith, today for sharing all your expertise with us. But before we go, any last words or wisdom or success story that you want to share with us before we let you go here?
I think the most gratifying thing is the opposite of the most frustrating one. The most frustrating thing for me is when a patient comes in, you demonstrate to them the extent and severity of their neuropathy. You offer them hope. They see the hope. this is great, but then they don't do it. That is so frustrating to me. And that happens more than it doesn't, I'm sorry to say. But the most gratifying thing are those patients that go through the protocol, are compliant with what we ask them to do, and they're out playing golf again or walking the beach, walking their dog, they're sleeping the night through. They are so grateful for the change in their life because of what we've been able to do for them relative to treating their neuropathy. So, those success stories keep you going.
Well, thank you again, Dr. Keith. Thank you so much for sharing your expertise and insights today. I truly believe that through conversations just like this, we can raise the standards of care for people living with neuropathy. For our
I would
listeners,
agree. And
yeah, exactly. And then for our listeners, if you or someone you love is suffering from neuropathy, don't give up. There are solutions, and you don't have to face it alone. And if you'd like to know more about neuropathy or what can be done, please subscribe to the Healing Wellness Show on Spotify, Apple, or podcast, and you'll get to see this episode with Dr. Keith or other episodes about neuropathy, and we can direct you to the right experts out there. Don't forget to subscribe to the Healing Wellness Show on Spotify or Apple Podcasts or your favorite platform. But we'll see you next time.